Welcome to the Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Pediatric Sleep Disorders and Special Education Need at 8 Years, a population-based cohort study. The authors used the Avon longitudinal study of parents and children dataset to look at over 11,000 children and their quality of sleep as measured at 4 different times during their first 5 years of life. They wanted to see how it predicted special education need by the age of 8 years old. Sleep quality was looked at in regards to children's snoring, sleep apnea, mouth breathing, nightmares, and difficulty sleeping. The children were then classified as to the extent of their sleep-disordered breathing, such as snoring, and their behavioral sleep problems, such as having nightmares. Children who had a history of sleep-disordered breathing had a 7% increase in risk for special education at age 8 for each interval where they exhibited symptoms. For example, if children exhibited sleep-disordered breathing twice in the 4 measured intervals, their risk would be a 14% increased risk. In addition, children had a 40% increased odds of special education if they showed behavioral sleep problems. Overall, this study suggests that there's a strong association between early childhood sleep problems and later special education need. The takeaway is that school personnel and health providers need to screen children for early sleep problems. There are many effective treatments available once the problem is spotted. Once the sleep problems are treated, school performance tends to increase. That concludes this webcast of the Mental Health Minute. Come back next week, and thanks for watching.